First of all, I need to tell you that I am wearing black tonight. I didn't want to wear all black, so I decided to wear white and black. And the reason is very few people know that the ribbon for melanoma is black. So, and May is Melanoma Month. The first recorded description of melanoma was from the Greek. And you might not realize this, but the word mela or melis means black, and the word oma means tumor. So when you break melanoma down, it's black tumor. The other thing that you might not realize just starting out is that melanoma is not a new disease. It's not a new disease. We think it is something that just came back in our generation or within the last 50 years. But we know from mummies that melanoma has probably been with us since the very beginning of time. Hippocrates actually talks about it in some of his early medical writings about a black tumor. They really didn't know a lot about it, but what they did know was that it killed people. And what they did know about it was that when they found the black tumor, and then they didn't call it autopsies back then, but when they actually looked inside the person after death, what they found is that these tumors had spread to other parts of the body. So this is not a new disease. But what we're going to find out tonight is it's a disease that is becoming very, very traumatic, and that it's affecting many, many people, probably more people than what you realize. With that in mind, how many of you are here tonight because you know someone that has skin cancer? Raise your hand. Okay, how many are you here tonight because you know someone that has melanoma or you've had melanoma yourself? You know, I hate to tell you this, but this afternoon I asked that same question. We did a 12 o'clock session today. We had about 125 lay people. We had counselors, we had coaches from Lamar, we had swim people that are going to be working with the kids this summer. And actually in this audience, there's many more people that have skin cancer and many more people that know someone or have had melanoma than in the group this afternoon, I think. So I don't know what that means, but I just think it's really interesting. And you might think it's because you're an older age group, but that's not true. Today at noon, we had several long-term care facilities here that actually brought people to the presentation, which I thought was pretty interesting. Okay, so as you know, you are the Cancer Crusaders. And tonight, the intruder is this little black person over here. And we are here tonight because we can it. Notice we've got the jars that say can the tan, okay? If you don't understand it, that's where it comes from. Okay, this is the intruder, and we can it. Now, this person that's laying down here that's beet red might remind you of some of yourselves. Now, I would like to think that our young people today are better educated and take better care of their bodies than some of us did who are called the baby boomers. And as I look around the audience tonight, I see a lot of baby boomers. So I know that some of you will understand what I'm talking about, especially you fair-haired, fair-skinned, blue-eyed, pale people. When I was growing up, and I'm not going to tell you what year it is, I spent many, many months every year at the beach. It was the place to go. I don't know where my mother was during this time to allow me to go to the beach so much without a seatbelt on and with my boyfriend to Bolivar. But we spent many nights, not nights, but days, nights and days at Bolivar. I was with the girls, he was with the boys, but anyway. And if you're a baby boomer, you're going to recognize this because we didn't know what sunscreen was, right? We didn't know what sunscreen was. We didn't know they made such a thing. I'm not even sure they made sunscreen back then. If they did, they didn't sell much. But I can tell you what they did sell. A lot of, anyone want to tell me what they sold? Baby oil. Baby oil, because it would reflect the sun. And my idea was that when I would go back to school, I would be the tannest, darkest person in the class, except for my friends who were African American. Actually, I was probably pretty dark. I was looking good back then, I thought. And until I grew up and I realized that that wasn't the best thing. How many of you, what did you use, those of you that are about my age, once we had the baby oil and we got sunburned, what did we use for the sunburns? How about vinegar? Anyone use vinegar? Vinegar works great for sunburns, still works great for sunburns. I don't recommend sunburns, but I'm just saying vinegar. And you don't smell too good once you use the vinegar. So this is how I used to look when I used the baby oil, because usually the sunburn came and the blisters came, and then if we were lucky, we got the suntan. Okay, so you're here tonight. You are a cancer crusader. That's what we all look like. We are cancer crusaders. The reason that we are is because when you leave here tonight, hopefully you're going to take one piece of advice, one little bit of information that you can use actually in your practice, or you can use in taking care of your patients, or in taking care of yourself, your loved ones, or your families. Because I truly believe, and I'm passionate about this, it's what I've spent my life doing, that education is power. And I tell people this all the time. Every one of you in here are nurses. It doesn't matter if you're retired. It doesn't matter how many years you've been a nurse. This year, I celebrated 40 years as a nurse. 40 years. And some of you have been here with me just as long. You know, we've grown up together. But the reason I say that is I always tell my students, and I usually tell them this about the second or third day of class. And if I have any students that I know, Rebecca, where are you at? She was one of my students early on. Yes, we have quite a few. I always tell my students, you know, once you start nursing school, everyone thinks you're a nurse. I don't know about you, but when you start, my students tell me auntie's calling because they think you're already a nurse. Your grandmother's calling, you know, your sisters are calling. Everyone thinks you're a nurse. So because you are nurses, you're a nurse 24 hours a day, 365 days a year, and you'll be a nurse until the day you die. Even if you think you're retiring, you don't get to retire. You're still a nurse. People will call you and you'll say, but you know I'm retired. Oh, that's okay. I need to ask you a question. You go to the Sunday buffet at church and you're trying to get your plate and someone says, listen, I need to ask you a question. And you say, I'm off duty. Oh, no, you're not. It's okay. I just need to ask you a question. So now you're going to have the information you need about melanoma, because there's nothing worse than being a nurse and someone asking you a question and you say, wait a minute, and then you have to run to the restroom and Google it, and then you have to come out and tell them what the answer is. I know none of you do that. So tonight, you're going to learn information. Not only that, you're going to put it in your little jar and you're going to can it and remember it. Okay, melanoma. Where does it come from? It comes from our melanocytes. You probably didn't even know you had such a thing, did you? It's the cells that cause your skin to have color. Okay, it is located in the skin. And as you know, the skin has 3 layers. And the melanocytes give your skin the color that it has. Now, the important thing about that with melanoma is that this is where the cancer starts. It starts in these cells. When the skin is exposed to ultraviolet radiation, the melanocytes make more pigment. Okay, and either it's going to cause the skin to be sunburned or it's going to cause the skin to be tanned. And I actually want to tell you several, and I call this pieces of trivia about melanoma as we go through, because there's many myths out there. First of all, there's no safe tan. There is no safe tan. A tan is as bad for your skin as a sunburn. And second, African American and darker skinned people do get melanoma. A lot of people think because they're darker skinned that they don't have to worry about it. And that's just not true. And that's one of the part of the information that we need to get out. For years, when I was doing education on cancer, and I'm sure we've got some oncology nurses here tonight, and they may hear this too. For years, I heard that only women get breast cancer, that men don't get breast cancer. Not true. Men get breast cancer too. So there are some myths that we need to work with, even with melanoma, as we go through this. One of the interesting information that I looked at as I was doing the research, and I knew this about breast cancer. I knew that breast cancer, if you have breast cancer, it puts you at risk for colon or ovarian cancer. In fact, sometimes the medications that they use for breast cancer, they also sometimes are able to use for colon cancer. I knew that. But as I was looking at this information on melanoma, I found this really interesting. And I don't have all the reasons for this. I'm not sure researchers do either. But what I found, a little piece of information that was hidden that said that people who have melanoma or who have family members have melanoma are also at risk for pancreatic cancer, which I thought was interesting. Or people who have pancreatic cancer are at risk, or more at risk for melanoma, which I thought was really interesting. As we look at different cancers and how they're interrelated, that's an area that I'm really interested in to see why, and possibly maybe it can give me some more answers for myself. Okay, what do you look for? We hear a lot about A, B, C, D, E. This is a very important bit of information that we need to know not only for ourselves, but for people that we work with. And for when a person comes up to you at church or when you're trying to go to the theater and say, listen, I've got this mole here. Can you look at it and tell me what you think? Usually what I first tell them is, I'm only a nurse. And the second thing I tell them is you need to go see a healthcare provider, because that's very important. I no way want to come across to you as I'm an expert on melanoma or skin cancers. I'm not. But one thing that we need to do as nurses, we need to realize that we're able to see something and know it's just not right. Have any of you had that intuition? I don't know if you've ever read Catherine Benner's book, but she wrote a book. It's called From Novice to Expert. Some of you may have heard of her. Some of you probably don't want to hear about her because she's a nurse philosopher. But her book is wonderful. It's called From Novice to Expert. And one of the things that she writes about is that the way that you can tell a nurse who is a superior or excellent nurse is that they actually have intuition. Almost like a mother who has a child, who takes the child to the doctor, and she tells the doctor, I don't know what's wrong with my child, but something is wrong. May not know exactly what's wrong. Nurses have that intuition. And you don't have to have been practicing for 40 years to have it. But if you look at something and something tells you there's something not right here, Catherine Benner says you need to listen to that, because nurses have a sixth sense about them. So what do you need to look for? First, A. It stands for asymmetry. Anytime you see the word A in front of anything, it means without. So what it's saying is without symmetry. One side, one area, doesn't look like the other side or the other area. So anytime you look at a mole or a freckle, a wart, anything that doesn't look the same on both sides, then there's possibly a problem there. B stands for an irregular border, or border that's irregular. This is a hallmark of all types of cancer tumors. It doesn't matter if it's over the skin, under the skin, or in the skin. Most of the time, cancerous tumors have irregular borders. That's because cancer has feelers, and those feelers are looking for a blood supply. Usually when a tumor gets to be about 2 centimeters, it doesn't matter where it's at, what it is, it moves, it metastasizes to another area because it needs a blood supply. So you look for an irregular border. C, color variation. And this is important, and a lot of people think, well, melanoma is just black. It's a black tumor, that's all it is. Not true. Melanoma can be brown, it can be purple, it can be green, it can be a bruise, it can be red. Many times with melanoma, what you're going to find is a discolored area that has several different colors in it. A woman shared with me not too long ago that she had a place on her back, and of course she couldn't see it. You know who saw it? Her 6-year-old granddaughter. She said, Mama, what's that on your back? It looks like a rainbow. And so she went and had it checked, and it was melanoma. So D, diameter greater than 5 millimeters, which is about the size of a eraser. But I can tell you, and I know for a fact that there's people in here who have melanoma that will tell you the places that they had were much smaller than that. Much smaller than that, and they were melanoma and quite serious. One of the things people will tell you, and I'm going to tell you in a few minutes, that melanoma can arise from a mole. I don't say that. I say that with a southern accent. This morning there was a lady here from Boston. She said, you have an accent. I said, no, I don't. You do. So, but she was really nice. She said, especially when you say that word mole. So I'm trying to do better tonight. Mole. If you have a mole or a wart, or if you have any kind of lesion like that, that's sometimes where melanoma comes from, but not always. Sometimes melanoma can arise when there's no other lesion there, and one morning you wake up and there's something on your skin and it wasn't there before. The other misconception, and many times this does happen, melanoma will grow very quickly, but not always. I think later I'll go through some of the stages, but there is a stage, a horizontal stage, with some types of melanoma, and this is what you need to keep in mind. Melanoma is a little bit like breast cancer. Not all breast cancer is the same, not all melanoma is the same. There is documented instances where people have a melanoma that grows on the skin, and it may grow for 25 years and still has not spread. But that's not always true. Then there's people that'll tell you, I just had this for a month, and it's already metastasized. So there is no normal for when something might spread and when it might not spread. Last one is elevation or evolving, E. At first they just said elevation, and usually, but not always, with melanoma or with other skin cancer, it does have a raised area. But more importantly, or as important, is it evolving, which means is it changing, is it growing, does it look different? Now, on the A, B, C, D, and E, and I'm telling you, next week, they'll probably add an F, G, H, and I. And you'll say, well, last week she said A, B, C, D, and E, because they are always adding letters. Before they're through, it'll go all the way to Z. Mark my words. But what they haven't talked about on this is that when it's skin cancer or when it's melanoma, it will ulcerate. And so many times, melanoma will bleed, it will crust, it will have scabs. And this is what we do in our society. And you know, actually you may not know this, but my grandmother used to say that I had bobos. You know where bobo comes from? It comes from bubonic plague. And they had bobos during bubonic plague. But what you do when you have a bobo is you put a Band-Aid on it and you cover it up. And see, what we do in our society, if it's out of sight, it's out of mind, it's covered up, I don't have it. And I tell people all the time that the worst enemy of us being healed from cancer, and I'm a cancer survivor, so I can say this, is fear. Fear of going to the doctor, fear of what they're going to find, fear of the treatment. And then it's like always when you're pregnant, everyone has a story to tell you about how it was when they were going through chemo or when they were going through radiation. And then you've always got the soothsayers that say, well, I'd never go through chemo. And so it scares people. And, you know, as a person that's been through chemo, I can tell you it's not near as bad as I thought it was. And there's reasons for that. And part of it is the wonderful nurses that we have and the medications that we have and the wonderful treatments that we have now. But with that said, part of the take-home message I want to get to you tonight is that the earlier something is assessed and diagnosed and treated, the better off you'll be and the better chance you have of survival. So that's a really important message to get to people. Because in our society, if people just hear the word cancer or the big C, then they run the other way. And that's not what's going to cure them. That's not what's going to have them being here years later. And I'm so excited because a couple of weeks ago, I got to see my first granddaughter born. And if you don't think she's cute, I have a whole bunch of pictures I brought tonight that I can show you. But if I wouldn't have followed up and had treatment and diagnosis and chemotherapy and radiation and surgery, I would not be here today to see her born. So I know people, oh, I wouldn't be here for my next shopping trip either. Okay, so what do you look for? Any change in an existing wart, mole, or other skin lesion, or the development of a new growth that ulcerates and does not heal well could indicate skin cancer, not just melanoma, but skin cancer in general. Skin cancer has a high cure rate if it's treated early, but neglect can allow the cancer to spread, causing disability or death. So let's talk about sunlight in melanoma. And I've already told you about the baby oil and the vinegar, and that really has what goes on later in life. But some of the facts I'm going to share to you tonight are really scary to me, especially if you think about our future generation. Christina talked about the importance of helping our future generation not smoke, not use the e-cigarettes. But just as important as that is helping them to protect their skin. Early sun exposure in childhood, and I know there's plenty of you in here that not only have grandchildren like I do, but have children. Early exposure in childhood is associated with higher incidence of basal cell carcinoma. Actually, the literature says that children as young as 6 months of age should be using some type of sunscreen. We should not have children out in the sun at all if they're earlier than 6 months of age. So 0 to 6 months, keep them out of the sun unless they're having to be in the sunlight, let's say if they're neonates and they have jaundice. But other than that, they shouldn't be in the sunlight. At 6 months, it's all right to use sunscreens. Just be careful and don't put it where they put their hands in their mouth. They shouldn't be eating the sunscreen. Research indicates that melanoma, though, is associated with short, intense episodes of sun exposure. And actually, this information came from an article that I read at WebMD, and I thought the example that they gave was really interesting. They said, think about the last time that you took a trip that may have been 2 hours long as maybe going to Houston or going to Galveston. Think what you did with your arm. You put your arm up on the door, and you drive. That's short exposures of sunlight on one arm, which puts you at risk for melanoma. Basically, the research says anytime that you go out, you should wear sunscreen. And if you're driving, you need to wear sunscreen because even the sunlight that's coming into the car when you're driving, if you have shorts on or whatever you have on, swimsuits, whatever, is short exposures of sunlight. History of repeated sunburns are associated with upper extremity melanoma. Okay, skin color is one of the most important genotype features for skin cancer. Malignant melanoma is very rare in African Americans. However, 67% of malignant melanoma in African Americans appear in places that aren't exposed to the sunlight, such as the buttocks, the back, the hip. How many of you remember who Bob Morley was? Okay, for those of you that don't, I'm going to educate you a little bit. He was a reggae singer. He has the record of the decade. He was very well known. He was at the height of his profession, and he actually died in the early 80s because of melanoma. And actually, this melanoma started in his toenail, okay, in areas that aren't usually exposed to sunlight. And the only treatment they had at the time that he died was an amputation of either his foot or his leg, and he refused to have that done, and so he died at the age of 36 from melanoma. The other area that people don't think very much about is that melanoma can actually start in your eye. Okay, and when I worked for a retinal specialist for a number of years, we actually saw several cases of melanoma. It's more likely to develop in people's eyes whose eyes are blue or green. And one of the things that you can do to protect your eyes, not only from melanoma, but from cataracts, is to wear sunglasses. And wear sunglasses that really protect you from the sunlight. So that's really a good thing to do. Of course, if you're like me, I have about 5 pairs of sunglasses, never can find them when I need them. They're around my house somewhere. Okay, if you have large congenital nevi or moles, freckles, they're considered a significant risk factor of melanoma. And one of the things that I need to tell you tonight is there's a recommendation that you really should have your skin checked at least yearly by someone that is a dermatologist, a family practice, nurse practitioner, physician assistant, but someone who knows what they're looking at. Because there's many parts of your body you can't see. There's parts of my body I don't want to see. So you need to have someone else really look at it to see what's going on. And especially if you have large freckling on your shoulders, that's a place that it may have developed over the years of sun tanning and sunburning. I don't know if any of you've noticed that. Persons with a first-degree relative with melanoma have twice the risk of developing melanoma. So that's your children. If you're a husband or wife that's having melanoma, then your children, grandchildren have twice the risk. And there are families that have a genetic mutation. And if you have a genetic mutation, it increases your chances even more. So what is melanoma? It's a highly malignant cancer. It doesn't occur as much as basal cell and squamous cell does, but it causes more deaths. It counts for about 4% of all skin cancers, but as I said, it's related to more deaths than any other skin cancer. It most often develops on the trunk for men, and some of the research I read, which was interesting, it also seems to develop more on their ears. And that's because men's ears are exposed. Now, some of us in here have short hair, and so because of that, or you keep your hair up, then again, your ears are going to be exposed. The legs are the most common affected site for women, especially the back of the legs. Sometimes that's overlooked because that's an area you don't usually go around the house looking at the back of your legs. We see what's on the front, and that's the cellulite. So we try not to look on the back because we might see more cellulite that we might not want to see. And the palms and the soles of the feet for darker skinned people. The number of new melanomas are increasing, and this is very sorrowful for me because the more information I read, the more I found out that melanoma is increasing more in our young people. Since 1973, the incident rate for melanoma has more than doubled from 5.7 to 14.31%. In 2011, it was estimated that 70,000 people would be diagnosed with melanoma. And of that number, a little over 8,799 would die. Now, this is 2015. Today, almost 100,000 people are diagnosed with melanoma, and the death rate has gone from 12 to 15,000. In some areas, you'll see 10,000, so 10,000 to 12,000 to 15,000, anywhere, depending on what literature you look at. So it is one of the few cancers that is increasing. Many of the other cancers that we have are on a straight line, which means they're not increasing. But if you look at melanoma, there's no straight line. It's just going up, 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 and up. So unless we do something to prevent it, to cure it, to take care of it, then it's going to get worse. And we don't really know why. Some people say, just as with colon cancer, maybe there's more cases of melanoma because now we're able to diagnose it earlier. Maybe because there's more education. I'm not sure I buy that. The other thing that people say, which may have truth in it, is that the ozone layer, and we hear a lot about the ozone layer, that the Earth is no longer protected as much from the rays from the sun because of everything that we've done environmentally, which might be another reason why we see problems in this area. The most common form of cancer for young adults, again, I want to repeat that. It's the most common form of cancer for young adults between the ages of 25 and 29. And the second most common cancer for people aged 15 to 29. For women ages 25 to 29, it's the leading cause of cancer deaths. The leading cause of cancer deaths. And it's the fifth most common type of new cancer diagnosis in American men and the seventh most common type in American women. The incident rate for invasive melanoma is highest in whites, who are almost 30 times more likely. But not only is it cost lives and cost problems for people, if you look at the amount of money that we spend on treating melanoma, $1.9 billion is spent in the United States. And in this changing healthcare environment, when more and more people don't have insurance, when more and more people have high deductibles, when more and more people are having problems finding physicians, you know, that's really, really scary, and we need to think about what we're going to do in order to help our populations. Rapid increases, as I said, have occurred in women, especially women ages 15 to 39. As I said, from 15 to 25, it's the leading cause of death. Among white older men, older than 65, the incidence has increased by 5.1% annually since 1975. So what we're seeing is an increase of melanoma and other skin cancers in young women, and an increase in melanoma and skin cancer in men over the age of 65. Part of this reasoning, according to the literature, is because a lot of men have spent a lot of time throughout their life working outside, if you think about it. Not only working outside, but I know from my own personal experience with my husband of 40 years that when he doesn't want to listen to me, like I tell him something needs to be fixed, he puts on his earphones and he goes outside on his lawnmower and he rides his tractor. And I tell him all the time, you need to put a hat on. He does put the hat on. And I'm not saying he has a big nose, but his nose kind of sticks out. And so then when he comes in, everything's been covered but his nose, and it's red. And I said, did you put sunscreen on? And he says, yes. I said, did you wear a hat? He says, yes. But still his nose gets continually burned. So I think also that men tend to spend a lot of time outside, gardening, mowing, cleaning, getting away from their wives, whatever they're doing, they're outside, or getting away from their partners. Whatever they need to be doing, that's what they're doing. So even as they get older. So I said earlier today that now, because my husband doesn't always listen to me, when I know he's going outside, I start lathering the sunscreen on him, especially his nose. And it's helped. But I say that because sometimes when people don't listen to you, then, and we can't control other people, sometimes we have to help them take care of themselves. So, as I said, this is not a new disease, and we think a lot of people think, well, it's just now being heard, but that's not true. Connecticut actually looked at 6 decades of literature, and they found that the overall incidence rose more than 17-fold in men and more than 9-fold in women. And interesting enough, there's more cases of melanoma here in the United States than any other countries, or any of the other countries for some reason. And because we live in the South, we have a lot higher incidence of melanoma and skin cancer than people who live in the North. Okay, as I said, it's 10 times more common in fair-skinned people and people with blue eyes, green eyes. The highest in Caucasian upper middle class professionals who work indoors. Work indoors most of the time, and then they decide, oh, it's Memorial Day, so let me go spend 3 days at the lake. And they have severe sunburn and blistering during childhood and tend to vacation in areas of intense sun exposure. Okay, now I'm just going to share some cartoons with you as we get through this. And I'm going to tell you they're probably copyrighted. So, but since I'm doing this for educational purposes, I'm probably okay. So this is the first one. I like this one. I couldn't pass it up. It's got a picture here of a tanning bed, and it says select a cancer, basal cell, squamous, or melanoma. Wouldn't that be nice to have at every tanning booth? And I know when I talk about tanning beds, it's very controversial because there are people that spend a lot of time and a lot of money. And I had 3 daughters. I know what young girls like to do before it's time for prom. They need to go to the tanning bed. I know what women do before they get married. They go to the tanning bed. They take their bridesmaids and now their groomsmen and their mom and dad and whoever else needs a tan. I know that. So tanning is one of the major risk factors. Both under the sun and in tanning booths is considered the primary suspect. 90% of squamous and basal cell cancer is caused by ultraviolet radiation. Now, one of the things that I'm going to talk to you about tonight is a lot of people don't realize that we have UVA rays and UVB rays, okay? The UVB rays are the ones that cause sunburns. And when you get a sunscreen, it's an SPF 15 or an SPF 30. The recommendation is that it's at least an SPF 15. Because if it is, that means that you have about 150 minutes of sun. If you don't perspire, if you don't swim, if you just sit and look pretty. But if you do anything else, you need to be replacing that at least about every hour because it will come off. And then we have the UVA rays, which a lot of people didn't realize for many years. As I said, that tanning is just as bad as sunburn. UVA is what causes the skin to tan. So what I'm telling you now is that the SPF 15, 30, 45, whatever you use, is going to cover the UVB rays, but it doesn't affect the UVA rays. So for that matter, you need to find a sunscreen that protects both UVA and UVB. And what you can look for is most of the sunscreens has an ingredient in that, such as zinc oxide is one that you might look for. Another one is ethylbutol. But if it has an oxide in it, what it's telling you is it's going to protect you with the UVA, and you need actually both of those. I say that because usually when you get in the tanning booth and you take your clothes off and hope nobody sees anything, most people don't put a sunscreen on that I know of. They usually don't sell sunscreen at the tanning booths. So the reason I'm telling you that, when you get outside, people will put sunscreen on or sunblocks on, but very few people think about how important that is when they get into a tanning bed or a tanning booth. So what are the risk factors? Well, number one, people living in sunny climates who tan or who sunbathe or get sunburns. People who burn easily. We know that fair-skinned people are much more likely to get melanoma and skin cancer. People who patronize tanning parlors. And I'm going to share with you some interesting information about tanning parlors, tanning beds, tanning booths that I didn't realize. Actually, there's some literature that says that tanning booths and tanning beds can become addictive. That when you go to a tanning bed, it actually releases an endorphin and raises your serotonin level, which actually makes you feel as good as if you had a chocolate candy bar or drank a Coca-Cola or a good glass of wine. And so because of that, people are addicted to sunning and to beds, and so they go back and they go back and they go back. And some people tell you, I just have to go every day. I just have to go every week. So as I said, it can arise from present lesions on your skin or from skin normally covered by clothing. Moles, weakened immune systems. This has to do with people who have some type of autoimmune problems, rheumatoid arthritis, thyroid conditions, people who have lupus, people who are taking medicine for HIV, people who've had medicine for cancer, chemotherapy, or radiation. But one thing that people don't talk about that I saw in the literature, which I understood and I knew because I actually teach it to my students, that when your body's under stress, no matter if it's stress psychologically, physically, emotionally, mentally, it drops your white blood cells and your T cells so that your body is not fighting off as much as it should. And actually what they tell us in the literature is that everyone has cancer cells in your body, but most of the time your body sees it and says, oh, this is foreign, get rid of it. And it gets rid of it. But what happens with people who have cancer is that you have the cells in your body and your body doesn't recognize that there's a problem there. And so it says, hey, stay in my body, just make more. And then the DNA changes, and then the cells of the cancer overtakes the weakened immune system. So we just need to keep that in mind. That's a whole nother lecture. But nurses who work under stress. I mean, there's no way to get around it. I saw in the paper not too long ago where they had a whole article about preachers and the stress that they work under. I said, let me tell you about nurses. I don't know if there's any job that anyone works in as a nurse that there's not stress. So we have to learn how to control that. And that's something else I tell my students. You have to take care of yourself. If you don't take care of yourself, then you can't take care of your patients or anyone else. And so that's a very important aspect of this. And then age. It does increase with age, but as you saw, it's not one of these cancers that happens after you're 65. It doesn't happen after you're 55. I'm talking about people who are 15, 16, 21 who are fighting melanoma. And then genders, males are more at risk than females are. Family history of melanoma, red or blonde hair, and I really mean red or blonde hair, not the one that comes out of the bottle, okay? You know, presence of multiple birthmarks, development of precancer actinic keratosis. This is the areas on your body that are rough and scaly. Obvious freckling on the upper back. 3 or more episodes of blistering sunburn before the age of 20. Think about that. Just 3. I can't even imagine. If you think about every summer I was at the beach. 3 or more years spent as an outdoor summer job as a teenager. So this, if any of you have or worked as a lifeguard, a counselor, football camps, soccer camps, swim coaches, 1 blistering sunburn as a child can more than double a person's chances of later developing melanoma. I think that needs to be on a big commercial somewhere. I mean, because most of us can deal with things when it's us, but we have a tremendous guilt if we think we cause problems for our children. And we'll do everything in our power to prevent our children from having problems. And I don't think that many of the parents really realize that just one blistering sunburn as a child can more than double a person's chances of later developing melanoma. Okay, let's talk about tanning beds, and this is very controversial, and I hope that there's no one in here that owns a tanning bed. I would not be surprised, because people make a lot of money on tanning beds. And if you talk to people, they'll tell you that the tanning beds are safe. I'm here to tell you that they're not, and there's a lot of literature out there that supports it. There's a lot of research that supports it. A lot of our legislators actually support this stand. 30 million Americans visit tanning beds. It grosses more than $5 million annually. And I told you that it might have an addicting, reinforcing effect to it. People who visit tanning beds, 75% more likely to develop melanoma than those who don't. I have another slide here that's probably copyrighted. Don't tell anyone, but I like what it says. Tanning beds killing one person every 50 minutes. With that said, Texas has been very progressive in this area, our lawmakers. Sometimes I like to think that maybe the reason is because Governor Rick Perry, you might not know this, but his wife was a nurse. And I think behind every man that makes a really good decision, there is a woman that's helping him, even if he doesn't know it. So this was a very important topic for her. On June 22nd, 2010, Texas Governor Perry signed a bill into law that prohibits anyone younger than 16 and a half years of age from using indoor tanning devices. Very, very progressive. There's only 11 states in the nation that even today in 2015 have done that. This bill also requires salons to obtain in-person parental consent for those between 16 and a half and 18 years of age. You know what's wrong with that? There's a lot of parents that don't realize the information that I'm telling you tonight. They don't realize how dangerous it is, and they're going in and signing for their children. What they're thinking about, oh, it'll make my daughter or it'll make my son look better for the prom. My daughter doesn't want to go to the prom because she's so pale. Someone might say something about it. So let her have a tan. More than 41 states passed laws that place restrictions, oh, that's okay, on minors' access to tanning beds as of 2015. As of 2015, now we have 41 states that have restricted minors' access to tanning beds. And there's 10 states now that prohibit tanning for those under 18, and that's Texas. And there's 12 states that ban it for those ranging from 14 to 17. So there's still very, very few states that have any restrictions on tanning beds. So any tan indicates that skin has undergone some type of cellular damage. So there's no tan that is safe. Women who use tanning beds more than once a month are 55% more likely to develop melanoma. And most women use it more than once a month. If they use a tanning bed, they go, usually, if you buy a package, it's unlimited tanning. You might not know that. And you can usually get, even now, I checked the prices. Right now, it's the start of the summer months, and you can get packages where you can tan as many times as you want to, several times a day, for as little as $55 to $75, up to $99 a month. So how does cancer melanoma cells spread? It does metastasize. It usually spreads to the liver, the lungs, or the brain. In these cases, the cancer cells are still melanoma cells. Now, that's one of the problems with melanoma. It doesn't just stay in one area. So with that said, at this time, I'm going to show you a video. It actually talks about skin cancer and tanning beds. Blake?
In Health News tonight, the risk of skin cancer among young people.
A Yale study finds the use of tanning beds significantly raises that risk. News 8 medical reporter Jocelyn Mementa with a closer look.
Lauren Hurd no longer longs for that healthy glow from frequent visits to indoor tanning salons.
Melanoma at 22, you don't think that you're ever going to hear something like that.
Lauren is convinced the concentrated UV exposure tanning indoors while she was in college led to the diagnosis.
You choose to ignore the warning signs and you choose to want to continue with this habit and addiction, and it brings you to a bad place.
Now a Yale study finds that people under the age of 40 who tanned indoors have a higher risk of developing skin cancer. Specifically, researchers found a 69% risk of early onset basal cell carcinoma among mostly fair-skinned participants compared to those who never used tanning beds.
It's the first time that we were able to demonstrate that using indoor tanning increases the risk of basal cell cancer in people in general and specifically in young women.
Study co-author and dermatologist Dr. David LaFell at Yale School of Medicine says that could explain why doctors are seeing more cases of BCC in younger patients.
And the reality is that the harmful ultraviolet rays that come from the light bulbs in a tanning parlor are in some cases many times more powerful than the natural sun that people tend to get.
BCC is the most common form of skin cancer and is highly treatable.
And while it doesn't tend to spread in the body, if it's neglected, it can cause local problems and damage.
A 3-inch scar
I just saw a little bump on my leg one day.
is a constant reminder of Lauren's scare with skin cancer, something she wants others to avoid.
You start kind of making excuses to yourself and to other people about why it's okay to continue doing it.
Last year, Lauren was among those who testified in support of an indoor tanning bill in Connecticut requiring parental guardian consent for someone under the age of 18 years old. It didn't pass. Supporters hope to resurrect it during this legislative session. Back to you.
But with that in mind, I wanted to, as I said, tanning beds is a very controversial topic, and there's probably people in here that have used or know people that use tanning beds, tanning booths. But I have a really, really good friend that I met today. And her name is Miranda, and she's actually a student at Lamar, and she's going to share her story with you about melanoma.
Good evening. Again, my name is Miranda Nance, and like she said, I was at the lunch today, and she asked me to come back this evening and share my story with you. My story is, in 1996, I was diagnosed with melanoma, and I was 21 years old, and the way that came about, or I probably wouldn't be standing here today, is I had moved here 3 years earlier. I was from Central Texas. I was just probably fairer than I am today even, and I moved down here close to the beach, and I thought, oh, you know, I need to be tan, and when I'm going to the beach, and I'm 18, and so I started tanning, and I did the $99 unlimited tanning at a place in Mid-County, still there today, and I tanned just year-round, and this was the 3rd year, and I had a spot on the back of my leg show up, and I had people saying, oh, you got mud on the back of your leg, and I was like, yeah, that just showed up. It's part of me. I don't know what it is, you know. And then my best friend came to visit, and she was like, I think that's a melanoma on the back of your leg. And, you know, of course I trusted her, not my parents, not anybody else, you know. And so I went in, and I had seen it, by the way. I'd seen it, I was thinking earlier this morning, I didn't tell this part of the story, but I had seen it in May, and I went to the doctor in October. So I was very lucky because I'd waited almost 6 months. And since the first time I had seen it. And again, there was nothing there before, just nothing on my leg. It just showed up. And anyway, I went into a doctor here in Beaumont, dermatologist, and I went in on a Wednesday, and by the next Tuesday, I had major surgery on the back of my leg. And they removed it, and they had to cut, I had all of the signs. I had A through E here. It really looked like E there at the bottom, but it was about the size of a pencil eraser. So I think I don't think it had grown that much, but it had like a red halo around it. It was raised just a little bit, and it was black. It just showed up black. But anyway, so they had to cut so many inches above, below, or it was actually centimeters, but they took a huge hunk out of my calf muscle. I really looked deformed for a while. But it was so worth it, and I thank her all the time because here I am. And I had to go for 5 years, I forgot that part, and be examined head to toe every 6 months, get a chest x-ray, and nothing ever came back. I was very fortunate. And, oh yeah, and it was stage 1. I'm sorry, most important part. It was a stage 1. And so I was very fortunate to have gone in when I did. And then now I just get checked annually. So that's my story.
One of the other interesting parts about this is no one in her family has ever had skin cancer, right? Or most definitely never had melanoma. And the other thing that she shared with us this morning is that I think one of the reasons she probably waited is you got married during that time, right? And she was on her honeymoon, and so she decided to wait. And of course, I'm sure she tanned more before she got married, and so she waited. And I know for a fact that there's other people in here that have stories, and so if we have a chance, we may have some of them if they're willing to share their stories a little later. So what are some of the characteristics that we've talked about? It can be painful or itchy. A lot of people are under the misconception, and it's not just melanoma, that if an area is painful, then it's probably not cancer. I mean, have any of you heard that myth before? If it hurts, it's not cancer. Not true. A cancerous tumor can be painful. It can be painless. Either way. And the best thing to do to tell people is, if in doubt, get it checked. It's always better to be safe than sorry. So it can show all of the A, B, C, D, E features, as Miranda said, or some people, it may not show any of those features, and it still might be cancerous, or it may show 2 of those features, and it could still be cancer. It doesn't have to have all of the features to be a cancerous growth. It may look like a bruise that doesn't heal, or a dark streak under a fingernail or toenail. Remember, I also said it can occur in the eye. A lot of people don't recognize that. It may appear in areas not exposed to the sun, between the fingers and toes, underarms, butt, and in the genital area. This is a picture of Bob Morley, and as I said, he died in the early 80s at the age of 36, and the cancer spread to his lungs and to his brain because he ignored advice to amputate the toe. And that was very, very sad, but he's not the only one. I mean, there's a lot of young people that are dying every day because of melanoma. And as I said, it is in a rise in our baby boomer population too, because these were the folks who were growing up during the time where people were literally laying out with reflectors and baby oil. For people in their 50s and 60s who had a lot of sun exposures when they were younger, a melanoma diagnosis is the manifestation of genetic mutations to their melanocytes, which is interesting to me and tragic at the same time. Ultraviolet radiation, either from tanning beds or from the sun, can actually change the DNA of your cells and how your cells replicate. And the reason I say that is, once your cells have a mutation genetically, you can pass it to future generations. And that's something to think about. So a lot of young people don't realize what they're doing to future generations, because everyone has to have a mutation first. Like Miranda said, no one in her family had ever had problems before. Now, I don't know if she has any mutations or genetic changes or whatever, but I'm just saying it has to happen to someone the first time. And there is literature that supports that UV rays can change the genetics of your body. Okay, staging. And this is just briefly the staging of melanoma. There is an initial radial phase, and what I want to tell you is that melanoma can be different, and so this isn't going to fit every melanoma tumor. And as I said earlier, some melanoma can spread very quickly. But this may last anywhere from 1 to 25 years. The melanoma grows parallel to the skin, The tumor rarely metastasizes and often is curable by surgery. Then you have the vertical growth phase, and I don't know what all of a sudden tells melanoma, hey, let's don't grow this way anymore, let's start growing down. Most likely it's ran out of a blood supply, and it needs a blood supply of some type, because I do know that cancer needs blood to survive. It's an atypical melanocytes rapidly penetrate into the dermis and then deeper into the subcutaneous tissue, leading to death and metastasis. They look at the size or the width of the growth, how deeply it has grown beneath the top layer of the skin, whether the cancer cells have spread to nearby lymph nodes and other parts of the body. And I think this slide is really interesting, because if you see in stage 1A, 5-year survival, which was probably where Miranda's was, there's a 99% cure rate, 99%. Look at stage 4, 5-year survival rate, 18%. And I wanted to just show you some different types of melanoma. This is truly the one that a lot of people think about when they think about melanoma. It's black. I don't know if you can see, but you can see those borders are not real regular, and on the very outskirts of it, you may not see there's a lighter reddish brown color. Is that what you said yours looked like? A lot like that. But this is also melanoma. And in this picture, I don't know if you can see it or not, but there's multitude of tumors. You know, multitude of tumors. In fact, in this tumor, there's probably 100 melanoma tumors. And this one melanoma. This is also malignant melanoma, and you can see it looks like a little bit different. Probably the one at the very top has had some ulceration, and that's why you see the clear area that's in there. And this is also melanoma. It kind of looks like a ringworm to me. You know, and many times it could be misdiagnosed. Again, if you are a practitioner or someone that sees these areas, it's always better to be safe than sorry. And the ideal person to be looking at this would probably be a dermatologist. So, again, this might be copyrighted, but I just couldn't pass this up. We have over here, I hope you can see it, we have a little pig, and then we have a piece of bacon. And the pig says to the bacon, maybe next time you'll try a little sunscreen. So we need to learn how to can the tan. Oh, and this one is two devils, and I'm not telling you where they're at, but I assume they're in hell. And one of them's talking to the other one, and he says, thank God for sunscreen. So this is public health initiatives. This is what we need to be telling our patients, our loved ones. This is what we need to do for ourselves. This is what we need to do to protect our children, our grandchildren. There's no safe thing as a safe tan. That's important to get across to people. People have problems even on cloudy days. Just because it's cloudy doesn't mean that you're safe. You still need to wear sunscreen. Avoid the sun between 10 a.m. and 4 p.m. Those are peak tanning times if you're a beach person. Wear sun protective clothing. That means long sleeves, that means hats, covering up your nose, covering up your ears. Use sunscreen with SPF 15 or higher and reapply it often. And as I said, sunscreen can be used on infants as early as 6 months. Just make sure that they're not eating it and putting it on their hands and putting it in their eyes. Decrease or avoid ultraviolet exposure. I thought this was interesting. You know, most of us have been checking the weather, but I don't ever remember checking the UV index. And so one of the recommendations was, if you're going out, check the UV index. Low is 0 and high is 10. And that they list that with the weather, which I didn't even realize that. They also list the pollution for the day. And allergies, they list the UV. Examine your skin every month, including the buttocks and genitals. Know your family history. If several members have had melanoma or pancreatic cancer, you could have inherited a risk. Remember that early detection saves lives. The first line of treatment is surgery, and if it's early, diagnosis. But I wanted to share with you some of the cutting edge treatment for melanoma. I think it's important, especially as healthcare professionals, that we're aware. Immunotherapy is an interesting line of therapy because some people appear to fight cancer better than other people with melanoma. And as I said earlier, many of us have cancer cells in our body and we're able to get rid of it. So why is there some people that's able to fight it off better than other people? And for years and years, we've done these clinical trials. But what we're doing now is we're realizing that people are individuals, surprise, and that because we're individuals, we probably need to individualize cancer treatment for different people. Melanoma cells may use natural pathways in the body to help avoid the immune system. And melanoma cells often have a protein called PD-L1 on their surface that helps them evade the immune system. So basically what it's saying is melanoma has something, the cells on those melanocytes have something on it that lets them be under the radar so that your immune system doesn't see that they should be there, and it's actually this PD-L1. So some of the newer treatments in 2011, and I think this is really sad because there doesn't appear until just recently a lot of research been done on melanoma. Actually, in 2011, Yervoy was approved. It was the first new drug for the treatment of metastatic melanoma in 13 years. The new drugs block that PD-L1 protein, or the PD-1 protein on the immune cells called the T cells, that's where it's at, that can help the immune system spot the melanoma cells and attack them. So basically what the medicine does, it helps your own immune system fight the melanoma. It helps your cells recognize that this is evil, it's foreign, and we need to get rid of it. It's the first drug to show overall survival rate, between 10 and 20% improved survival rate. So it was really an important research drug that was approved to fight metastatic melanoma. Interesting enough, in 2015, a second new cancer drug called Intruder, which is also a PD-1 inhibitor, was put on the market, and it improved the survival odds of patients with skin cancer, melanoma, and it actually, in a head-to-head study, actually worked much better than Yervoy. So there's actually two drugs now. Actually, there's two other drugs that I could find are in clinical trials that might be put on the market later this year. And I found this interesting because I've read some of the research in the literature, and it talks about, I mean, as a cancer survivor, I was really interested in why did I have cancer? You know, and that's one of the questions people have when they have cancer. Why me? Actually, I told God, don't you want to go down a couple of houses and find someone else? I mean, I'm a worrier. I'm not the one that's supposed to get cancer, but he didn't listen to me. So, but what the literature says, pathophysiologically, they think cancer probably comes from two sources. Either it comes from a virus or it comes from inflammation. They know that chronic inflammation increases the chances of having cancer. So if you have chronic inflammation, whether it's of the gut, whether it's of the breast, wherever it is, of the skin, you know, if you have a mole that's in a place where your bra strap continually causing problems, inflammation, or viruses. Many viruses such as hepatitis, herpes, you know, increase the risk of cancer. So we think it's either viruses or some type of inflammatory process. If you're under stress, that's another reason why they think that might contribute, is because your body is constantly, and that's another thing with cardiac problems. They think it comes from chronic inflammation. So a lot of the diseases that we have comes from either inflammation or viruses. Now with that said, they're actually looking at two vaccines are in clinical trials. One is TVAC, and it's engineered from the herpes virus, which I don't know if anyone else find that interesting, but I thought that's kind of interesting. The other one, the approval is pending from the FDA, and it will, if you may read about it, it's supposed to be approved in July of 2015 for melanoma. The other vaccine is Cavitac, and it's engineered from the cold virus, which I thought was interesting. Both of the vaccines they're looking at are coming from viruses. And interesting enough, you might not know this, but the cold is actually a number of different viruses, and with all the research and the literature, we have no cure for the common cold. There is no cure. You know, if you get a cold, what does the doctor tell you? Go home, drink fluids, go to bed. Does anyone do that? No. Okay, then they have targeted therapy. In healthy cells, the BRAF gene helps direct cell growth. In half of melanoma cases, there is a mutation on this gene. That is the gene. The other one is the CD4 one, which is another mutation on genes, but half of them come from this BRAF gene mutation. In August 2011 and then in 2013, 2 new drugs were approved to inhibit the mutated BRAF gene, Zalvaraf and Timfenilor. And these drugs are now used together to fight metastatic melanoma as of 2014, which I find is interesting too, because we know that usually when you give drugs in a cocktail, I mean, if you're taking chemotherapy, usually they don't give you just one chemotherapeutic drug, they give you 3, 4, whatever it needs together to fight the cancer. And so again, they're putting drugs together to fight melanoma. And then one of the newest treatments for melanoma is adoptive cell therapy. And this one was really interesting to me too. The idea is that you can grow, train, and transplant parts of the human immune system. And this one is being used on patients in trials, and actually it's been approved from some patients who have advanced cancer. TIL is a tumor infiltrating lymphocytes, which helps your cancer grow. And in TIL therapy, a tumor is harvested from a cancer patient, a patient that has melanoma. They take the tumor out, and then the white blood cells that are inhabiting the tumor, which hold the power to fight the disease, are grown in a lab, which I thought was really interesting. And then they give that back to the person to fight the melanoma. So that's what they do. They take this white blood cells, they grow them in the lab, kind of like in vitro fertilization of melanomas, and then they put them back in the person. And this is actually, you can read about this young woman. She actually had melanoma that was stage 4, that had spread to her liver, her pancreas, her lungs, and her brain. Supposedly, they did this adopted cell therapy. She was one of the patients in the trial, and now she's in complete remission from melanoma. So with that said, I think there is some research out there, because melanoma has been increasing, that's going to help. And I think we're going in the right direction. But we as healthcare providers, we as human beings, can do a lot just by knowing the facts and figures and educating other people about melanoma. So, as I started out with, and some of you are going to think this is not very smart on my part, but I want you to remember something. And so I want you to write one way you'll prevent melanoma for yourself or someone else, because I think it's important. If you spent your time coming here tonight, and a lot of you are really tired, I know, and I appreciate it, then you need to put it in your can, which is actually a jar. Can it like you would do peaches, or it's time to can things. Remember it, and then actually do it. Because it doesn't matter what education you get, if you don't use it, you don't spread it, you don't tell someone, then it's not going to help. And lastly, I just want to tell you thank you for coming tonight, and I appreciate all of you so very, very much. Thank you.